Good morning, good afternoon, good evening, colleagues from across the world. A warm welcome from a sunny Cape Town. It's my privilege to share you some thoughts and lessons learned from our project was done in partnership with the Bezos Center. I'm Klaus from Pressentin. I'm the head of family medicine here at the University of Cape Town. And this is our group on the left, the list of colleagues who have been participating in our project titled Innovations to Reduce Morbidity and Mortality Among People Living with Diabetes in Vulnerable Communities in Cape Town, South Africa. As you can see, we represent two universities, University of Cape Town as well as Stellenbosch University, and this project was done in partnership with the Metro Health Services of the Western Cape Government Health. So, to introduce our setting, at the time of writing the proposal for this project in July of last year, 2020, South Africa had the most cases of COVID on the African continent, and the Western Cape was the epicenter of the pandemic. Our communities have an existing burden of chronic conditions, especially the poor communities in Cape Town record prevalence rates for diabetes of around 28%. And poor outcomes due to COVID are especially more common in people with diabetes. In response, the Metro Health Services, which offers the public sector primary care services to the uninsured, lower socioeconomic population, decided to decongest and de-escalate their services. This was done to create capacity to respond to the surge of patients with COVID and to keep high-risk patients with chronic conditions from vulnerable communities out of these healthcare facilities. As a result, people with diabetes have much less access to primary care due to these restrictions during the lockdowns enforced by the government, as well as the reorganization of primary care, and as such were being more at risk. Several innovations were implemented by the Metro Health Services during 2020 and 2021, and these include reorganizing of primary care services, home delivery of medication by community health workers, patient education and counseling initiatives, as well as the active screening, testing and early interventions for people with diabetes. This is one example, which was an illustration from a publication which illustrates the measures that were adopted by making use of the home delivery of chronic medication from the central dispensing unit in parcels delivered by the community health workers. And there were a lot of innovations to also make sure that the service was brought to the patient's home. The community health workers also played a very central role in the community screening and testing campaign. So these responsibilities include screening of households with chronic patients receiving these home delivery of their medication, and any evidence of decompensation required referral to the primary care facility. And this is in line with the community-oriented primary care principles embraced by the Western Cape government. Our project had the following theory of change to monitor and evaluate and learn from these innovations. As you can see in the middle section, we were especially interested to learn how these innovations supported people living with diabetes to be more adherent and to be capacitated in terms of self-management, and also to facilitate earlier diagnosis and intervention for patients with diabetes diagnosed with COVID, and also have targeted infection prevention. And all of these we hoped would lead to the outcomes of reduced infection of COVID, hospitalization, improved outcomes, as well as glycemic control of the chronic condition. Our fieldwork and data collection was completed during June to August this year in 2021 at these 4 facilities as illustrated on the map. We aim to have an equal representation and a number of respondents from these facilities, and these are the 269 respondents from the 4 facilities is illustrated in this pie graph. At the moment, we are busy with the further analysis and interpretation of the findings, which we plan to present in a peer-reviewed paper in an open access journal. But some of the lessons that one could consider at this early stage is already to consider what ways we can use to reorganize and rethink how we deliver and organize primary care, and especially thinking beyond facility-based care into the community space, and how are we able to make use of the lessons learned to facilitate self-management and enhance control, especially for stable patients that might not need as much in-facility contact, but we could reach and support through other means, including community health workers, as well as cell phone and other applications-based services. I would like to acknowledge the following colleagues, especially the Bezo Center, for granting us this co-RIG fund, as well as our partners in the Western Cape Government Health, especially the teams at these 4 primary care facilities, our partners and colleagues at the University of Cape Town, as well as the University of Stellenbosch. This is a slide which provides some further reading resources. Thank you, and hope to learn more from you and connect with you in the future. These are my details, and you're welcome to reach out to us. Goodbye.